KPBS On Demand is supported by UC San Diego's Art Power, co-presenting Mayrig with Art of Ilan on January 29th at the Loft. Tickets at artpower.ucsd.edu.
Welcome in San Diego. It's Jade Hindman. On today's show, hear about the new federal guidelines for childhood vaccines and what local doctors are saying about them. This is KPBS Midday Edition, connecting our communities through conversation. The U.S. Centers for Disease Control and Prevention released updated guidelines for childhood vaccines last week. That advice, however, runs counter to recommendations from California and San Diego County health officials. So, what do parents need to know about the changes and which recommendations to follow? I'm joined by Dr. Pia Panaraj. She's an infectious disease specialist with Rady Children's Hospital. Dr. Panaraj, welcome.
Hi there. Thank you very much for having me.
So glad to have you here. So what did the CDC announce last week on childhood vaccines?
Last Monday, the CDC took away several of the vaccines and changed them to only for high-risk groups or what's called shared decision-making, meaning only after discussion with the doctor.
So the recommendations for getting the hepatitis A and B vaccines were changed. Can you explain more about those diseases and what the previous recommendations were?
Sure. Yeah, they made changes to several vaccines, including hepatitis A and B, a meningitis vaccine, RSV vaccine, rotavirus, which causes diarrhea, and then the flu vaccine. So hepatitis A and B, they cause diseases that affect the liver. It actually means inflammation of the liver. Hepatitis B in particular can lead to a chronic infection that can cause liver cancer. And so we have a vaccine that's available that could prevent a cancer, basically, and the changes to the vaccine recommendations makes it seem like it's an optional vaccine.
What about changes to COVID-19 vaccines?
So COVID-19 vaccine is now by the CDC recommended just for those at high risk, and only if families discuss it with their physician. So the American Academy of Pediatrics recommends the vaccine for all children under 2 years of age because we know that all children under 2 are at high risk just for being that young age. They recommend the vaccine for high-risk children 2 years to 18, and then the California Department of Health and other professional societies recommend the COVID vaccine for all adults, just because there are still severe complications from COVID-19.
Yeah. This news comes still, with flu season in full swing. So, can you tell us about the flu picture right now and how this CDC move could really impact kids in San Diego this winter, and especially as they head back to school?
Yeah, definitely. Flu is hitting hard, especially on the East Coast. We saw it hit hard in other countries, so we expected that. It hit hard on the East Coast, and it's making its way west. We're definitely seeing flu now. There's kids having to stay out of school because of flu, and we're expecting the severity to hit in the next couple of weeks as well. And so, and that's with about 40 to 50% of our population vaccinated. So it's a little scary to think about what it'll be like if nobody is vaccinated.
Yeah. Well, is it too late to get the flu vaccine at this point?
It's never too late to get the flu vaccine. Flu is already circulating in San Diego County. It takes about 10 days to 2 weeks for the flu vaccine to work, but flu will continue to stick around probably for the next couple of months. And so getting the vaccine now is still better than not having it at all.
When talking about childhood vaccines, some of the debates around them are not always about which vaccines should be required, but when they should be given. Can you explain that a bit more for us?
Yeah, the immunization schedule is made so that the timing of each vaccine is determined by when the child is most likely to get the disease and when that child could have the most complications for the disease from the diseases. And so that determines when the vaccine should be given. So you want to give the vaccine right in time to protect them when they're most at risk. You don't want to wait for it to be too late for them to have already been exposed to the disease and then try to get the vaccine. It doesn't work that way.
So, what is the CDC's reasoning behind these changes?
Well, that's the concern, is that nothing has changed with what we know. All of the original vaccine recommendations were made with a lot of thought and review of the data that's both safety data and effectiveness data. And all of that is the same. It's what we've known from before. Nothing has changed to justify downgrading the recommendations. And so I think that's what's important for people to know. Pediatricians and providers know that, and even the California Department of Public Health knows that. And so here in California, we're all still giving the same vaccines as we always have, because those vaccines work and they're safe and effective at those times that we recommend the vaccine.
So, what should parents do about getting all this different advice from different places? While the CDC's guidelines have changed, other health bodies, including here in San Diego County, as you mentioned, are sticking with what we've been doing. What's your best advice for parents who might be confused
Right.
right now?
Yeah, thanks. That's a great question. And that's really the key about all these changes. It's leading to a lot of confusion, unfortunately. So, when parents think about, some of those changes said, well, you only need the vaccine if you're a high risk group. And I just want to point out that no one ever thinks they're in a high risk group. Just as an example, my family vacationed to another country this over the winter break where seat belts were not required in the back seat. And my children, who have always worn seat belts and never questioned it for their safety, all of a sudden became very relaxed about wearing their seat belts, said, oh, well, is this really necessary?
Uh-oh.
And that's the thing about these new vaccine recommendations that say, oh, just get it if you're high risk or only after discussion with your doctor. It makes people question what what has been known to be true, that these vaccines are safe and effective. And all of a sudden now, is safety a concern? It becomes a question. And do we need to discuss it with the doctor first? It's always, the doctors are always there and ready to answer questions. And so those discussions are always welcome. But I want to emphasize that it's important for people to know that all of that safety information, it's still there. Nothing has changed at all. And so your doctors are ready to have that discussion with you. But please know that those vaccines are still safe. Nothing's changed.
Right. And as for school requirements, do any of those change?
Nothing, no, none of the school requirements have changed. The vaccines that are recommended for school stay the same. The idea is to prevent the infection from spreading within the schools where children are close together. They share a lot of things. Touch the same door handles, share pencils and erasers, even pass their phones around to each other. It's really easy for diseases to spread in school, and that's why we have those vaccine recommendations.
Yeah. Um, Earlier, you mentioned this idea of shared decision making. Really navigating healthcare decisions, it can be hard. So, do you have any advice for parents on how to best approach conversations with pediatricians?
Yeah, so shared decision making means that It's a decision with the doctor. And while it sounds great on the surface, it unfortunately means that parents and families must now advocate for themselves. And that's not always easy. It's hard to get a doctor's appointment sometimes. The appointment is the time is limited when you're there with the doctor. So, but families definitely can ask questions if they are concerned or are not sure about something. Ask the pediatrician. They should feel empowered to be able to bring up a question and have it answered with their pediatrician or their other healthcare provider.
Right. I've been speaking with Dr. Pia Panaraj. She is an infectious disease specialist with Rady Children's Hospital and professor of pediatrics at UC San Diego. Dr. Panaraj, thank you so much for joining us today.
Thank you so much.
That's our show for today. I'm your host, Jade Hindman. Thanks for tuning in to Midday Edition. Be sure to have a great day on purpose, everyone.
KPBS On Demand is supported by the San Diego County Toyota dealers, presenting a new 2025 Tundra designed to combine performance and comfort with up to 437 horsepower and 10-speed automatic transmission. See your Toyota dealer. The San Diego County Toyota dealers. We make it easy.